Almost every household has at least one child in it, and questions about pediatrics are frequent. Due to a mother's love for her child, she by nature is very curious and wary with regards to anything that may arise involving her child. No matter how trivial, a mother will seek answers. In this course, we will cover the most common pediatric illnesses in a way that's very easy to digest. This course will may be beneficial for all levels of education, from undergrads to postgrads, and even for parents and for general information. One of the most important things we'll focus on during this course is the dose of medications. I'll go over a very simple way to obtain the dose per weight so that you aren't memorizing the dose for each drug. And remember, the most important doses are for antibiotics. When determining the dose per weight, you'll need to know if a scale is not available. The weight of the child can be determined easily as follows. At 3 months, they weigh about 5 kilograms. At 6 months, they weigh about 7.5 kilograms. And at 1 year, they weigh about 10 kilograms. Then, after that, add 2 kilograms for each year of age until the child reaches school age, the age of 6, and weighs 20 kilograms. So at 1 year, the child is 10 kilograms, 2 years, 12 kilograms, 3 years, 14 kilograms, 4 years, 16 kilograms, 5 years, 18 kilograms, and at 6 years, they will be 20 kilograms. Feeding. The best milk is mother's milk. It is notably secreted after the 3rd day. Before that, colostrum, a yellowish secretion, is secreted and provides adequate nutrition and immunity no matter how hungry the child is. If the mother isn't satisfied with milk production, you can give the child something like a baby drink. The following is a prescription for a newborn child. You can give them baby drink when needed. Tolbrin eye drops, which is an antibiotic for the eye. You should give it 4 times a day. You should add alcohol to the umbilicus 3 times a day to make sure it's nice and clean. And you should massage the baby with Johnson's baby oil twice a day. So you should always use the Tolbrin eye drops, antibiotic eye drops 4 times a day, alcohol around the umbilicus 3 times a day, and Johnson's baby oil to massage the baby's skin twice a day. There's also something you can give to the mother, a prescription for the mother, if there is no milk secretion. First, you prescribe adequate nutrition. You prescribe adequate rest, mentally and physically, and make sure she's receiving adequate fluids, especially milk. There's also something you can give her, like Lactomax, which you can give her 1 tablet 3 times a day, then 1 2 times a day, then 1 times a day, until there's adequate milk production. The mother's milk is the best choice. It provides the child with all it needs except for 2 things: iron and vitamin D. You can give vitamin D drops from birth, and you can give iron to the child when their birth weight has doubled. So if the child is born at 5 kilos, then when they reach 10 kilos, you can give them iron. In the first 3 months, the child should only be given milk. Milk only, not even water. Preferably mother's milk. If that's not available, then powdered milk. Then, if that's not available, you can use bovine milk or buffalo milk. If you use the buffalo milk, however, then it must be prepared in the following way. It needs to be diluted, it needs to be boiled, and sweetened. It should be diluted with water with a ratio of 1:1. This is especially important for children before 6 months. Then it should be boiled, and then when it reaches boiling, it should be stirred for an additional 5 minutes. After that, it should be sweetened with 1 spoon of sugar for every 100 milliliters. This is to enhance the taste of the milk to make it close to that of the mother's, and it also will increase the calories. Note that bovine milk should be avoided as it has an increased incidence of colic and indigestion, and it also contains no iron or vitamin D like the mother. Most powdered milk or formula comes with three different stages, so you usually see three numbers next to it. A number 1 is for infants before 6 months, below 6 months. The number 2 is for after 6 months, and 3 is for after a year. There are also special formulas depending on the condition. You have premature formula for premature infants. You have formula that is EC or extra care. This is helpful for infants with colic and flatulence. You have formula that is AR or anti-regurgitation, which helps keep it down in the stomach. You have formula that's FL or free lactose. The free lactose formula is especially useful after a case of gastroenteritis due to the lack of enzymes that digest the lactose. And lastly, we have soy milk for those with allergies to milk. The doses of most formula is as follows. Most of them are 1 scoop per 30 milliliters of water that have been previously boiled. Some of the more common American formulas are 1 scoop for 60 milliliters of water that have been previously boiled. Nutrition. One of the common things you'll be asked about is when and what the child can eat. And you'll also be asked about weaning and certain food schemes. To keep it simple, from 4 to 6 months, you can give Cerelac with rice, then wheat, then vegetables, and then fruit. Then you can add blended potatoes, carrots, bananas, apples, and biscuits. All food should be blended or mashed though. In the 7th and 8th months, you can introduce sauteed vegetables, vegetable soup, noodle soup, chicken breasts, ground beef, and fish fillet, as well as egg yolks. Note that egg whites should not be given before 1 year. So you can give egg yolk, but the egg whites should not be given before 1 year. After 1 year, almost anything goes. Note that before introducing new foods, you should wait 1 week before each type of food to see the child's reaction to the new food. For example, you can give carrots for 1 week, then bananas after that. This will help you determine if the child has any allergy to that type of food. Special notes that must be observed are as following. No juice should be given before 9 months, as the juice will be more likely be sweeter than the mother's milk, so the child may refuse to take the mother's milk after that. Avoid giving anise, fenugreek, and caraway, as they can cause diarrhea. In the first year, you should avoid giving chocolates and sweets, as this may lead to an increased incidence of diabetes type 1. Also, honey should be avoided in the first year, and no antinal should be given as it can destroy the intestinal bacterial flora.